Caught in a state of confusion, many parents trying to save their children from opiate addiction, including heroin, say their insurance companies are banking on their child's failure not to have to pay to help them.
It is a similar plea to the viral one New Jersey Governor Chris Christie made for addiction treatment earlier this month. Today, our Matthew Simon continues his investigation and tells us from lawmakers to the state's top cop, they say it's time for the insurance system to change.
It speaks about the difficulty we have with these insurance companies.
Of all the letters the head of Dane County's Parent Addiction Network, Ellen Taylor Powell, shared with us about frustrated moms and dads trying to use their insurance to get their opiate-addicted children help.
Because long-term seems to be defined by the insurance companies, not the clinicians.
Conrad's mom's was the most heartbreaking. After the 22-year-old survived a June heroin overdose, he was court-ordered to have a drug assessment. After his mom begged their insurance company, Unity, 5 or 6 times that next month to pay for help, Conrad had planned to make the next call. The night before he died, we even spoke about the need for treatment. He told me he knew he needed it and he would try to get off of work early the next day and we would make the calls together, his mom writes. 8 hours later, my husband and I found him dead in his room. Unity's spokesperson said HIPAA prevented them from commenting on Conrad's case, only saying if a patient's care meets national standards to be deemed medically necessary, even with a court order, they cover care.
My stomach is kind of clenching. I mean, it's a horrible feeling.
Taylor Powell says stories like Conrad's often happen because insurance companies do not approach addiction as a disease.
There is a deep frustration.
Over 163,000 people in Wisconsin were abusing opiates in some manner. We can't treat that many.
And many of those, like in the letters we saw,
Now comes the disheartening part.
are young people like Conrad. Attorney General Brad Schimmel says while he does not have the legal authority to make insurance companies pay for treatment,
Mike, wake up.
he is on a mission to also use his pill-stopping Dose of Reality campaign to make sure insurance companies realize addiction is a brain-hijacking disease that needs to be treated.
That the insurance industry hears this message. No one would suggest to someone with lung cancer that you smoked your whole life, so you deserve cancer and we're not going to do anything to help you. Well, individuals become addicted. They're suffering from a disease, and I think we need a better focus on getting them help.
We're having conversations with the health insurance industry in Wisconsin.
State Representative John Nygren, who's in the process of leading the charge to change state heroin prevention and treatment laws, also says he wants Wisconsin insurance companies to change their model. One he says currently relies heavily on addicts failing lower levels of care before finding the most effective treatment.
It starts with discussion, and I think it comes to ideas and potentially at the end an agreement where this is what we won't necessarily be looking for, failure first.
This is what we would refer to as a suicide cell.
For now, Sheriff Dave Mahoney says the failure model means his jail cells are full of 18 to 25-year-old opiate addicts who can only afford to detox at taxpayer rehab.
That's why we have full-time medical staff who can help monitor our ability to care for them in our facility.
While Mahoney is proud of lives being saved, like the 23-year-old Sun Prairie woman who overdosed in a car off an opiate in this town of Windsor gas station parking lot, he hopes one day the 4 to 5 detoxing every week in jail will not have to do that in solitary confinement.
It should be a medical bed. It should be more calming and more welcoming.
Today in Dane County, jail is where many parents who say they're unable in the end to afford to help their children, even though they have insurance, are glad to see they end up.
If you're concerned about the safety of your child, maybe that's a safe place.
And it is a safe place, Conrad's family says they wish their insurance could have helped them get their son to. I asked if he knew what would happen if he died, and he looked at me and said, "You would be devastated." Devastated does not even cover what we feel. Comrade's mom ends her letter by saying, "A beautiful mind is gone now because the system did not feel he was worth saving. The system is stacked against us." And once again, Unity is Conrad's family's insurance company who insisted in general, even if there is a court order involved, they pay for medically necessary substance abuse care, something his family strongly denies to this day. The insurance commissioner's office tells us under federal and state law, all insurers are required to offer an independent external review if a treatment plan is not what the member wants, is not approved by that company. The office's spokesperson says they've only received 14 complaints this year, which they say could be an indication many simply do not know they have that right. If parents need resources, which we've heard from many of them, we know they do, we've posted resources on channel3000.com to the Parent Addiction Network. The woman you saw in that story can offer help.
How many young people end up in the Dane County Jail with an overdose?
You saw 4 to 5 detoxing. That's what we saw in the story. 4 to 5 detoxing in solitary confinement. A nurse we talked to says 8 to 9 every shift are addicted to opiates, ending up in the jail. So this goes beyond what the sheriff showed us. That's just solitary confinement. There are numerous kids we're talking about, 18 to 25-year-olds detoxing right now in Dane County.
And if you missed the first part of your investigation yesterday, the costs of treatment for this is absolutely staggering.
Thousands and thousands of dollars. I think a parent who wrote us a letter, something like $68,000.
Which insurance doesn't cover.
No, out of pocket. We talked to a lot of parents going into bankruptcy over this.
And it's a problem that's not going away.
No.
Matthew, great work. Thank you.
Thanks, Matthew.